Tina Drago on KDWN 720 AM, coming to you from Studio A at Beasley Broadcast Studio, talking to you about healthy Las Vegas. Today we have in the studio Dr. Phil DeVore. He's with the UNLV Dental School, and he's going to talk to us about oral hygiene and how we can take care of our teeth and really what it's all about. We hear a lot of buzz about it, but we don't necessarily know how it really affects us personally. Good morning, Dr. DeVore. How are you?
Good morning, Tina. I'm just great. Thank you.
So let's get started. Tell me why it's so important, besides the bad breath thing, and rotten teeth and aesthetics. Why is it so important to have oral hygiene in our lives? Where do
People
we
come into the office for all kinds of reasons. Sometimes they're just sent in by a spouse or a family member or maybe a new boyfriend or girlfriend because it's just time.
Okay.
Because it is bad breath that drives people in all the time. But why is it really important? It's because your teeth are part of the rest of your body. Some people think that bleeding gums is okay, but if your eye was bleeding, would you think that was acceptable?
Absolutely not.
Yeah, so it's kind of like that. So there's a whole problem with the mouth being connected with the rest of the body, and people forget that if they've got an infection in their mouth, it's going to be somewhere else, and it goes into your bloodstream, and it's pretty serious, actually. And we find that we have patients who neglect themselves, and they become very ill. So one of the main reasons is because you want to take care of your mouth just like you take care of the rest of yourself.
Do you know our providers at First Person Care Clinic actually do an oral check on the patients that are diabetic because we don't necessarily always have the ability to take off their shoes and inspect them there, but we can tell very quickly in their mouths because the veins are so close to the skin. So there's a lot of information there that I think people avoid and miss.
We spend an awful lot of time teaching our students about the need to do a real thorough oral evaluation, not just looking at the teeth, which is sort of what dentists are interested in, but everything else. Because, as you said, there's an enormous amount of information in the mouth that people don't really think about because they're thinking about teeth. And our students also are concerned about learning how to repair teeth and all of that dental stuff, but they forget about the oral medicine connection. So we have a tremendous...
Don't we have a cross-promote, a collaboration between like MD and DDS so that they can actually collaborate and help each other?
We have a medical school coming at UNLV. And
that's phenomenal.
Yes, very exciting. And it's going to be right nearby where the dental school is by UMC. It's going to be part of that big campus there. So when we have a medical school, it is currently planned that we will be teaching there so that we can reacquaint the physician students, the medical students, with that oral systemic connection. It's super important that people understand that the two are not unrelated and that we really see an awful lot in the mouth that has everything to do with their general health. Diabetes is a crucial element. All of our older patients have dry mouth. They have all kinds of issues that we see as dentists, and we see it more often than their physicians do because sometimes physicians just start with that tongue depressor on the mouth, on the tongue, and their view of the human body starts in the throat. They don't really look in the mouth very much.
They bypass everything around it and go right for the throat. Okay.
Correct.
So what's the most common dental disease out there?
The most common disease in the world is periodontal disease, gum disease.
And tell us how that can affect. I mean, we hear about it. We hear about the bleeding gums and we hear about the tender gums. But really, how does that affect the rest of our body? Is it an initial trigger? Is it like that first red flag that people should be aware of before it gets worse? Or is it by the time your gums are diseased, it's too late?
It's never too late.
I love hearing that. Okay.
We have amazing technology now with implants and just practicing dentistry is really, really exciting right now. So the answer to your question is never too late. And one of the earliest signs of infection is the redness around the edges of a person's gums. And by then they already have an infection. And most people who aren't going to the dentist regularly will have some of this inflammation, this redness around the edges of the gums where they attach to the teeth. And that's the first sign of gum disease, periodontal disease. It's an insidious disease. They don't feel it. It doesn't hurt. It's not particularly uncomfortable. And it's very slow. So it grows over time. And it's a serious condition because, as we said earlier, the bacteria that are growing underneath the gums get into the bloodstream, travel to other parts of the body. They can cause infection in other places. People who have prosthetic hips and knees and artificial joints, artificial heart valves, the bacteria from the mouth can actually cause those prosthetics to fail.
Oh, that's serious.
It's catastrophic. It could be fatal, and you can lose a limb. I mean, it's a very serious problem. So it's really important for people in general to take care of their mouths, but specifically as people get older and they have more medical issues, diabetes because of the blood supply issues. There's all kinds of reasons for people to go to the dentist that they don't think of, and we can help them prevent disease before it happens. And that's the key. Dentists have been involved in prevention more than any other medical specialty since we started recommending fluoride. And I know that's a controversial issue, but in communities that are fluoridated, children have considerably less decay than in other communities, and it really does work. So we've been trying to put ourselves out of business forever.
But fortunately, we love candy and we like to ignore our teeth, so you're safe. There's no problem there.
We're happy to fix anything that you mess up.
So how bad is soda? Because I think soda's the devil's juice. How bad is soda for people's teeth?
I think everybody forgets that those little bubbles are made of CO2, which is an acid when it gets into the water. So all soda is acidic, and your teeth are crystalline. And so the acid eats away your teeth just like any other acid. So yes, all soda, even diet soda, is bad, and it's okay to drink soda. There's no reason why you can't drink soda. Just drink some water after. Rinse your mouth with some water afterwards. Brush your teeth, normally 2-3 times a day, and don't let the soda sit on your teeth and gums. Make sure that you rinse it out after you're done. And I know that's a tall order for some people, but if you chug one soda after another, you are going to have problems. And especially if the soda has sugar in it, because the sugar feeds those bacteria that live in our mouth. It's normal. People have millions and millions of bacteria in the most healthy mouth that's supposed to be there. Right. But they love that sugar.
I got to tell you, okay, people out there, don't drink soda. Just don't drink soda. Soda to me is like one of the worst inventions I think there is.
I'm telling you, I think it's okay to drink soda. I just don't think you should drink it all day long, one after the other.
Okay. I'll bend a little, but not much, only because you're the medical professional.
Moderation in all things, Tina.
So what's the most important thing people can do or they can teach their families about preventing cavities?
Everything starts with diet, right? I mean,
I love that you said that. Thank you.
Yeah. I mean, everything starts with diet for everything.
Yes.
If you're going to stay healthy, if you eat poorly, the chances of you remaining healthy are slim.
Exactly.
Now, some people beat it, but the bottom line is that we want our children to have a healthy diet. We want them to drink a lot of water. If those sippy cups have sugared stuff in it, and juice has a lot of sugar in it, then it's not going to be good for their teeth or their bodies, right? Refined sugars are unhealthy, and even fruit sugars are unhealthy in large quantities. So the key is to have a sensible diet. They should drink fruit. They should drink soda. They should drink milk.
Soda.
They should drink all of these things, but in moderation.
Sippy cups can hold water too, people.
Yeah.
They're perfectly capable.
Yeah, there's nothing wrong with that. And it's really interesting to me that the millennials, my students, my kids, people in their 20s and 30s, they don't use plastic water bottles because it's not good for the environment.
Exactly.
And they carry around a water container, and it's got water in it, shockingly. Mm-hmm. So it's a health issue. So the first thing that people can do is for their kids is diet. And then it's a great idea to give a child a kid's toothbrush to chew on. Can't hurt anything.
No.
Better they should chew on that now. When the dog picks it up, then you probably want to change it out.
Next one.
Yeah. But that's a great idea. Let them chew on a toothbrush. Let them get accustomed to the feel and the taste of a toothbrush and all of that. And brush your kids' teeth. When a kid's really small, we like to suggest that parents use either a child's toothbrush or maybe even a little gauze pad to brush the teeth off in the mouth. But the sooner a child gets used to having their teeth brushed, the better. Just, I don't know, for the people who have dogs, a perfect example is, I hate to always equate animals and people, but the truth of the matter is, if you've got a puppy and you start brushing that puppy's teeth with a toothbrush and dog toothpaste, which probably tastes like liver or something. Anyway, if you accommodate that, if the dog becomes accommodated, if a child becomes accommodated, if any animal, humans being animals, if anybody is accommodated to something early on, that's what they're used to. That's what they'll accept. So that's the idea. The sooner you start with your kids with all of these habits, if you
positive habits,
if you habituate any person, they will accommodate to these things. It'll become part of their life. So that's the key, is to get kids used to brushing. Flossing can be introduced anytime.
I love those little floss sticks.
They're great.
Because then you're not sticking your fingers in your mouth. You got the little,
Oh my!
apparatus.
All right. Well, look. And people stick their fingers in their mouth anyway. If you like the floss stick and it gets you to floss, that's fantastic. I have patients all the time. They show me all these funny little devices and they're carrying them with them and they're very proud of this.
Yes.
Look what I'm using, and I'm thinking, oh my gosh. Anyway, it doesn't matter.
Yeah.
Whatever you're using, if it works, I'm all in favor
You're all
of
in
it.
favor of it. Okay.
Yeah, I just don't want you to do something that's harmful. People who chew on big twigs and stuff and try to stick them between their teeth, that's not a good idea.
No.
And I've had people do that. But all of these
like
devices.
The cavemen?
Yeah, people are primitive in nature. So all of these devices are great. And anything that gets you comfortable with an ongoing habit of taking care of your teeth is a great thing.
Now, fluoride, you mentioned, I don't think Las Vegas has fluoride in the water. Do we? Nobody. Does anybody drink the water in Las Vegas?
Well, that's a really good point. And the fact of the matter is that in the past, we consumed the water that came out of the tap.
Right.
When we were growing up. But now a lot of people drink bottled water of one sort or another.
Some of it comes out of Milwaukee's tap.
Yeah. That's not a bad kind of water either, but we can't give that to our kids necessarily. The point being, though, that fluoride in the water, there's a new mandate from, I think it's CDC, around 0.6 parts per million. But the point is that we want to have a certain amount of fluoride in the water. It isn't in most bottled water. So if a parent is giving their child primarily bottled water or
reverse osmosis
or RO water or any of those kinds of water that doesn't have fluoride in it, they should supplement and they should see their pediatrician or their pediatric dentist so that they get the right dose. They just take fluoride vitamins.
Oh, really?
Sure.
Or a rinse? I had my kids, I thought, had to take a rinse when they did
A rinse is helpful, but generally speaking, they're not going to swallow the rinse. We want to have fluoride in the water that a child drinks, we want to have fluoride in the child's system, not just as a rinse early on, because as the teeth are building when a child's an infant and their teeth are growing, we want fluoride to be part of the enamel as it grows, because
so if it's in your body, it goes through your blood grows your teeth.
Yes, and yeah, good.
It's good
thank
fertilizer.
You. Thank you. And yeah, it is like fertilizer. Especially it's a classic example. Fertilizer is perfect because here in Vegas, we were having trouble in our backyard. Our trees weren't growing well, and so this year we fertilized. We put it into the water system, and it now comes through that way. And it's crazy how things are growing, right? Well, that's what happens with your teeth in terms of fluoride. If you grow a child with fluoride in his or her system in water or through vitamins or whatever source, those teeth will be stronger because the fluoride's incorporated into the enamel. And it makes the enamel stronger, more resistant to decay, more resistant to fracture, just plain stronger. And there's a big window, variety of doses of fluoride that are good. So it's called therapeutic index. But how much fluoride the child gets,
right?
It as long as they reach a certain threshold, the teeth are going to be stronger. And the the effects, the deleterious, the bad effects of fluoride don't come into play until they're many, many times greater than the recommended dose. So all of these risks associated with fluoride, most of which are just really kind of discolored teeth, don't come into play unless you're giving your child 10 times what they're supposed to get. So it's not going to happen.
Right.
Unless the child lives in a place where the water is naturally over-fluoridated, which can happen. And we see that from time to time with patients who come in and they have slightly discolored teeth because they had so much fluoride in their water. But it's not because they overdosed on fluoride tablets. It's because they grew up in a place where the water was naturally fluoridated. Here in Vegas, we have very little fluoride in the water. And so if in conjunction with the dentist and the pediatrician, a parent supplements fluoride to their child will have beautiful, white, natural teeth, very strong, and that's the key. They'll resist decay, and it's for a lifetime.
So honestly, parents, I think this is something you're familiar with vaccinations and you're familiar with checkups, but you really should be asking about fluoride also for your child, because healthy teeth are the key to really a successful adult life when it comes to, nobody wants implants and dentures and all that stuff, and we see it far too young. People in their 40s and 50s, having all this extra work done on their mouth that they could have avoided by having parents that gave them fluoride early on.
Most studies link longevity and having your teeth. So people who don't have their teeth tend to live less long.
Well, that's sad. Okay. I've got all my teeth.
There
You're
you
listening to Dr. DeVore from UNLV's Dental School on KDON 720. Dr. DeVore, let's talk about the UNLV Dental School. We have a phenomenal school here in town. Everybody's talking about how we need a medical school, but we do have one. We have the dental school here.
We have an amazing school. I've taught at other dental schools in other big cities, and when I first came here, I really didn't know what to expect. And I am so pleasantly surprised by what an outstanding school we have. It's very competitive, and our students that we're producing are amazing. They're phenomenal practitioners after they graduate, and many of them are going on to specialty programs that are very selective. So the dental school is producing exceptional dentists, and I'm really proud to be part of that.
That's phenomenal. And what kind of services are being offered there right now? I mean, it's located downtown off the UMC campus.
Correct. The dental school's on Charleston, right at Shadow Lane, just a little bit
1001 Shadow Lane?
1001 Shadow Lane. It's just
right on the corner.
It's really like 1700 Charleston. We're just a little bit west of the freeway, and we're just a little bit east of UMC on the same side of Charleston. It's a big school. We have...
Look for the red UNLV sign.
Of course. We have 80 students in a class, so we have over 300 students there, plus our graduate program. So it's a very big school. It's a typical graduate school. And we perform all the normal dental services. We have an orthodontic graduate program, so we have orthodontics. We have a pediatric graduate program, so we have children's dentistry performed by both specialists and dentist training to become specialists. We have all the general dental services. We have oral surgeons, we have oral pathologists, we have periodontists, endodontists, we have all of the normal dental stuff. And we have sort of two ways to go. We have the student clinic, where we train students to become dentists. These are people who've finished college and they're going to dental school. So
are they second year, third year?
We have a 4-year program.
Okay.
So they've all finished college and now they're learning to be dentists. It's a doctoral program. They'll graduate with a Doctor of Dental Medicine degree.
So if you're on a budget or you don't have dental insurance, you need to have your teeth looked at, you can always contact the dental school and have the professors?
Yeah.
Or the students, right?
We have two choices. You can either see us in the faculty practice where the professors practice, or you can go into the student clinic. And the student clinic has reduced fees. It's an amazing opportunity for people because they're getting their dentistry done by very enthusiastic dental students who are learning to perform these procedures. Now, they're not doing it for the first time. They've all been through 2 years of very rigorous training in the laboratory. Where
they practice on themselves, right? Each other?
Well, they do learn to give injections on each other. That's a little traumatic initially, but yeah, it's exciting for them. So they've spent 2 years learning to become a dentist in the sense that they've taken all of their scientific courses, anatomy, physiology, microbiology, all of our basic science courses, as well as the dental school courses like how to make dentures, how to drill teeth for fillings and crowns, and all the stuff that we do. So they learn how to do that pretty much in the first 2 years in the classroom and in the laboratory. They spend hundreds and hundreds of hours, thousands of hours really, in the laboratory practicing all these techniques. And at the end of those 2 years, after they've passed a bunch of very rigorous exams and demonstrated their proficiency, we put them in the clinic with actual live patients. And that's when
But they've earned that spot. That's a privilege to get into.
Oh, it's a privilege, yeah. And they know that they have to prove themselves to the faculty in terms of their ability to provide service before they get to go in the clinic. And it's a real honor for them. They're very excited. So they get in the clinic, and that's when the public can come in and actually have their dentistry done. And what occurs is the students take on patients, they create a relationship with them, they work the case up, in other words, do a complete diagnosis and treatment plan, all in conjunction with the faculty. So as faculty, we work with our students to teach them how to take care of people and how to give great care. And that's what they do in our clinic. And all of the treatment is supervised by faculty members who are all dentists like me.
And they're clinicians too. So understand that it's not just a teacher overseeing a student when you go in there. You've got some of the best dentists in town that are adjunct professors there, that are working in the dental school, that if you went to their private practice would be considerably more than giving the school an opportunity.
Oh my gosh, the fee for our services is between a third and a half of the fee in the community. So people save enormous amounts of money having their dentistry performed at the dental school by the students. And of course, they're getting remarkably good care because every step of every case is being managed by one of the faculty members. And it's interesting you point this out. Many of our faculty are adjunct, meaning, and that's what I did for the first 9 years, I think, that I was at the school. I had a private practice in Summerlin, and then part-time I would actually volunteer some of the time, and then
it was your community give back, wasn't it?
Yeah, well, it was because I gave up a part of my day, and a lot of our adjunct are doing exactly the same thing. They're leaving their private practices to come teach the students. And the beauty of that is that these are dentists who are actually out in the community every day seeing patients in their private practice that are teaching these students how to do things well and how to relate well to patients and how to create patients who want to take care of themselves, who are enrolled in the concept. It's a trick to get a patient to want to do what you tell them to do when they leave the office. It's one of the classes I teach, actually, is I teach a communication class about that subject, is how to have patients appreciate what we're doing, because most people don't necessarily appreciate it. And now we have a phenomenal faculty where our professors are really focused on patient care and on creating great dentists. So that's really our product. At the end of the day, what we do is we produce amazing dentists to go out into the community.
How can someone get an appointment at the UNLV Dental School? Is there a number to call?
Yes, of course there's a number.
Can they call the main number? Or is there a number on there? I'm looking at the card, so I'm trying to figure out which number.
Yeah, this number is actually the number of the faculty dental practice.
Well, give it up to us. Come on.
I'm going to have to get the other number for you.
Well, give us if you ask for the student, then they'll transfer you over, won't they?
Absolutely. So anybody who's listening today, they can call 702-774-8000.
That number again?
774-8000. And that will be the faculty dental practice, and I'm the director of that practice. So that's different from the student clinic. What we have there is an opportunity for the public to come in and be treated by faculty members. So everybody who treats patients, including my hygienists, are actually faculty members at the dental school where we teach part-time and we see patients part-time. We're full-time professors, and we kind of divide our time. So
that's phenomenal.
in fact, he had a job for $30 an hour. So we were really excited for Stan, and Stan was beside himself.
That's phenomenal. Thank you, Dr. DeVore. This is Tina Drago with Healthy Las Vegas. Today's story was all about how UNLV helps people transform their lives. Have a wonderful day. Thank you.